Thank you, Mr. Chairman, very much. Welcome, sir. In the dark days of 2020, it was the partnership between the federal government and state government, research centers, and companies like Moderna that made it possible for us to make a huge medical breakthrough. And it was places like the National Institutes of Health and health systems and companies, communities, and getting people vaccinated. That was the real triumph. People young and old at every income got their shots for free. We helped to lift the weight off of hospitals and brought the innovation of Cambridge to community health centers and communities around the world. But now the list price of COVID vaccines may more than quadruple. And the cost of high drug prices is that families may need to pay higher health care premiums. Healthcare providers may struggle to afford doses for their patients, and uninsured people may not get vaccinated at all. And even one person not getting vaccinated because they can't afford it is a health system failure. So biopharmaceutical innovation can cure disease, extend lives, and end epidemics, and they should be praised for that. But the real power of that innovation comes from guaranteeing that every community, no matter of their income or zip code, has access. So during the height of the crisis, it cost about $26 per patient for the federal government to vaccinate an individual. So for a family of four, that's $104. The price you're now talking about, $130 times four for a family of four, brings that price out to $520 for a family of four, up from $104. So you can see why we're so concerned. That's a huge price increase. It's clearly going to be limiting access for many people in our society. And so my question to you is, do you have a way of lowering that price even further? Have you finished all of your calculations? Because just by pricing it at that level, our country's going to see millions of people unable to be able to afford it. And if they can afford it, it's only because insurance premiums are going to be going up for them and for Americans across the country. Can you lower it any further?
Thank you, Senator, for your question. So let me start with access. Because of how things are set up in the country, people that are insured will have no out-of-pocket. People that are not insured, we are currently working on a program and we want to make sure it's as easy as possible to access it so that people who are not insured also have access to a vaccine at no cost. That is really, really important to us. The big unknown for us as we move forward is the unknown and the complexity. We do not know what volume will be required in the fall of 23. We do not know how much wastage there will be in the country. If you look at the fall of 22, and I think this is interesting data to think about and reflect upon, US government bought 160 million doses. 50 only million went into arms. So the true cost to the US taxpayer was way above $26 because they paid for all the doses that ended up going to waste. And also this does not include the cost of distribution, which now we're going to have to bear. So over time, we'll have to see where things stabilize in terms of volume.
And I appreciate that. It's only that as time goes on, identifying where the waste is becomes easier and easier because of experience. So obviously, that was an absolute rush that we were in. But as time goes on, you get better in terms of efficiencies in logistics, in making sure that the number of people who we think are going to be wanted are matched up within a logistical system that gets it to them. So I guess what I would say to you is that it's important to be looking at additional efficiencies, additional ways you can lower this price because it's going to be critical to making Americans feel they can afford it. And following on that, Moderna announced that you have developed a potential cancer treatment for melanoma using mRNA technology, which is an exciting development in cancer treatment. But Merck's cancer drug list price is $175,000, $175,000. And it generated $21 billion in revenue while patients skip treatment or take on significant medical debt. So, Mr. Bancel, how can you use your role to ensure that the cancer drugs you're developing are affordable for people who are going to need them?
Thank you, Senator, for your question. That's something we will look into it as time goes by, closer to launch. At this time, our focus is to start the phase 3 study as fast as we can, because we believe, as you said, the data is very encouraging. 44% reduction of recurrence of disease on melanoma or deaths. So it's a big impact on patients. And as we get closer to launch, we'll have to figure out, we have to even invent how to manufacture those drugs. Because unlike the vaccine, which we make in larger batches, this is an individualized medicine. So we'll make a different one for you or for me if we have cancer, because we'll have to adapt to the gene of our disease. So we'll have to figure all those things out.
A drug that is unaffordable is an hallucination to ordinary people in our country. So it has to be made more affordable. Thank you, Mr. Chairman.
Senator Lujan.
Thank you, Mr. Chairman, and Mr. Bancel, thank you for being with us today. We've heard a lot of numbers thrown